So welcome everybody. I've said we were going to give you all a few minutes to just be logging on and getting joining us today. So let's kick off today's session. My name is Stephanie Best, and I'm an associate professor in implementation science down in the University of Melbourne. Let me share. See if I can share the right slide. That one, and that comes from Andrew and I chatting earlier. From me going, oh no, we're fine. So hopefully you can see the opening slide for today's session, and if I can just shut down a few windows at the same time. So I'm going to be introducing Andrew in a minute, but just before I get to that, I'd just like to share an acknowledgement of country. And so I'd like to acknowledge the traditional custodians of the lands wherever you may be. Macquarie University is on the lands of the Watamatagal clan of the Darug Nation. And you can tell that I don't live up Sydney way, so I apologise for my mispronunciation of that. I am on the lands of the Wurundjeri people of the Kulin Nation. And with all the hoo-ha that seems to be going around at the moment about whether we should or shouldn't be acknowledging country, I just feel it's a very small things that we can be doing. And so I would like to pay my respects to elders past, present, and any First Nation joining us today. So, as I said, welcome to today's Implementation Science Interest Group. We are joined by Andrew McLachlan, and I haven't checked how to say your name, so I apologise if I've mispronounced that as well. Andrew is going to be presenting to us today on fidelity to theory and using a realist perspective and bringing that to implementation science. I'm very excited to have Andrew speaking with us today because Andrew is coming from an education background. We very commonly have people from a health background, and myself included in that. So I think it's going to be very interesting to be capturing some of those thoughts that Andrew will have been developing from a lot of that implementation science work that happens in the education space. Andrew can draw on development and realist approaches to improve teaching quality and also to be around translating evidence into policy insights that actually change practice. And he has got keen interests in evaluation theory, education policy, and knowledge translation. So let me stop sharing my slides. Which I managed to do significantly more smoothly than I did the sharing slides. And Andrew, I'd like to hand things over to you.
Wonderful. So I might just check, Stephanie, can you see the title slide?
No, I can't see. Oh, yes, I was speaking too soon. Perfect. Yes, thank you.
Wonderful. Okay, well, thank you everyone for joining today. And as you can see, I'll be talking about fidelity to theory, a realist perspective on implementation science. I'd also like to acknowledge the traditional owners here in Brisbane, Meanjin, the Yuggera people, and pay my respects to their elders past and present. The image you see here is of the Brisbane River where I live, and it's known locally as Maiwa, the 334-kilometre brown serpent that wraps itself around the peninsula before passing out through to Moreton Bay. And I'd just like to take a moment to acknowledge the deep and enduring connection the Yuggera people have to this land and extend all this respect to First Nations people from the lands you're coming from today. So, as Stephanie mentioned, I'm an educational researcher and evaluator working for the New South Wales Department of Education. And today we'll be exploring how realist thinking can complement implementation science research. But my aim today is really a persuasive one. I'll be making a case for the value of theory. And by theory, I mean something quite specific. From a realist perspective, programs are theories incarnate. They are practical manifestations of certain beliefs and assumptions. And these theories could be based on anything. They could be based on trust, on leadership style, on norms and social pressure. They just need to be explicitly built into the program architecture so that we can test and evaluate them. And I'll just check technology. Stephanie, is everything coming across perfectly?
All
Slides,
coming
audio?
across. Yep, coming across great. Thanks.
Thank you. So today we'll be exploring theories related to a key strategy within implementation science, namely adaptation. And if we look to frameworks like the Consolidated Framework for Implementation Science, adaptation is defined as the process of modifying an innovation, or perhaps even the organization itself, to improve its fit and integration into local systems. Now, as you'll see, it's the theories behind why we adapt programs that really matters in realist methodology. And I've titled the paper Fidelity to Theory to reflect this concern. My main contention is this: of all the things we should prioritize in our investigation, it's theory that matters most. And the quote you see here is widely accredited to Kurt Lewin, the German-American psychologist. In his words, there is nothing so practical as good theory. It's theory that helps us explain events, not just describe them. It's theory that helps us anticipate outcomes, not just observe them. And it's theory that enables us to make claims which are coherent, causal, and most importantly, transferable. Now, I'll be developing this argument throughout the paper, but just to give you a sense of where we're heading, the following questions provide a basic structure. First, we'll explore how fidelity has been traditionally understood in implementation science. Next, we'll examine one of the most highly cited frameworks in implementation science, the Consolidated Framework for Implementation Research, or CIFAR. And we want to see how it conceptualizes fidelity, especially under two main strategies, which is adherence to original designs and the selective adaptation of key components. Finally, we'll consider how realist methodology can build on frameworks like CIFAR to develop theories that are causal and that we can test empirically. So, turning now to the first question, fidelity has typically been treated as a measure of implementation quality. If a program adhered closely to its original design, it was considered to have high fidelity. If it deviated, then the program's effectiveness was assumed to be somehow compromised. And it was Linda Duesenberry and colleagues in 2003 who formalized a more structured approach to program integrity. They proposed 5 dimensions for measuring it: adherence, dose, quality of delivery, participant responsiveness, and program differentiation. Now, its adherence, the extent to which program components are delivered as intended by program developers, that's critical for our discussion today. And the reason why is that it's often seen as directly opposed to adaptation. In fact, they're seen as existing in a kind of binary or tug of war. These early implementation models really prioritized program integrity. And so adaptations were generally seen as a threat to implementation quality, as something to monitor, minimize, and in some cases even avoid. But over time, we've seen the field evolve its thinking considerably. adaptation is no longer viewed purely as a threat to implementation quality. In fact, under the right conditions, skillful adaptations can enhance program effectiveness, especially if they can improve a program's fit with local contexts. And the quote you see here is from Laura Damschroeder, the lead developer of the Consolidated Framework for Implementation Science Research. In her words, interventions can be conceptualized as having core components, the essential and indispensable elements of the intervention, and an adaptable periphery, adaptable elements, structures, and systems related to the intervention and organization into which it's being implemented. Put simply, it's not a program's form that necessarily matters. It's not its content or its superficial features, its procedures, its materials, its sequence of delivery. It's the program's core functions, the so-called active ingredients that are presumed to make the program work. And this brings us to CIFAR. So for those who are not aware, CIFAR is what's known as a determinant framework. It collates the most influential constructs or determinants from the literature into a single coherent structure. And its purpose is to help researchers identify potential barriers and facilitators to implementation. There are 39 constructs in total, grouped into 5 overarching domains: the innovation, the outer setting, the inner setting, individuals, and the implementation process itself. So let's have a look at each of these domains in turn. First, we have the innovation, the program, intervention, or policy being implemented. And it includes constructs related to how the innovation is perceived, whether it's seen as evidence-based, advantageous, adaptable, or overly complex. Next, we have the outer setting, and this covers all of the social, economic, political, and competitive factors external to the organization. It includes critical events like global pandemics, but also things like community values, laws and regulations, even external pressures like mass media campaigns, funding requirements, even expectations around benchmarking. In the inner setting, we have all of the determinants within the organization itself that could potentially impact implementation. It includes physical layout and technology infrastructure, the composition of teams, communication systems and workflows, as well as equipment, resources, and funding. But it also includes more intangible items such as staff attitudes, culture, and tension for change. Next, we have the individuals, the people actually involved in implementing the innovation. And this, of course, includes people's knowledge, their beliefs and motivations, but it also includes constructs related to role clarity, trust, and alignment with the intervention's goals. Finally, we have the implementation process itself. And this includes all of the activities, all of the strategies and efforts to plan for implementation, to engage with stakeholders, to deliver and adapt the program, and of course, evaluate its progress. Now, clearly, as a taxonomy of key determinants, this framework is impressive. But like any framework or model, it has its limitations. The most notable of these is that it doesn't provide clear insight or guidance for how and why these determinants produce particular outcomes. And this becomes particularly clear when we look at constructs related to adaptation. Now we're getting into the specific constructs of the framework. First, we have adaptability, the degree to which the innovation can be modified, tailored, or refined to fit local context or needs. These are drawn straight out of the framework now. Next, we have compatibility, the degree to which the innovation fits with local workflows, systems, and processes. And finally, over in the implementation process domain, we have adapting, the process of modifying the innovation and/or organization for optimal fit and integration into work processes. Now, to be fair, there are causal ideas embedded within each of these constructs. The problem is not that CIFA doesn't touch on causality or doesn't suggest causal influences. The problem is that this causal logic isn't made explicit, nor is it connected to other constructs across the domains. And so this prompts us to ask some questions. First, in what circumstances is adaptation necessary for successful implementation? How do implementers determine which features of a program to preserve and which to adapt? Are there situations where adaptation should be minimized or avoided altogether? And perhaps more provocatively, in what contexts might strict adherence and standardization be a better option than adaptation? This last question is crucial because it invites us to think seriously about the causal role of context in implementation outcomes. And this is something that scholars like Mitchell Sarkis have pointed out. As he writes, the problem with determinate frameworks is that they often examine context separately as compiled lists of important factors, which are not explicitly linked to why these may differ between sites and how they influence the social processes that impact outcomes. Put simply, context is either decoupled from the mechanisms that cause change, or the two are conflated. And this means that causation is effectively black boxed. So, how do we open up this black box? Well, from a realist perspective, the first thing we need to do is to stop conflating context and mechanism. Context, from a realist perspective, refers to the necessary conditions that enable or constrain change. It could include anything. It could include leadership engagement, resource availability, interpersonal dynamics, even the policy or regulatory environment. Mechanisms, by contrast, are the shifts in people's reasoning in response to program resources. And this is a crucial point. It's not programs alone that generate outcomes. It's the interaction between the resources a program provides and the changes in people's reasoning that occurs in response to those resources. And Ray Pawson and Nick Tilley, the founders of realist methodology, make this very point. In their words, programs work, that is to say, have successful outcomes, only insofar as they introduce the appropriate ideas and opportunities, in other words, the mechanisms of change, to groups in the appropriate social and cultural conditions, that is, context. And you can put this more simply. In fact, you might have even come across this formula or heuristic before. Context plus mechanism equals outcome. So where to next in this presentation? In the final slides, I'd like to show how realist thinking can be used to build on the constructs in CIFAR and create some initial hypotheses. We'll be focusing on adaptation, but in the discussion, we can certainly talk about how we might develop hypotheses around other implementation strategies, even strict adherence, for instance, and talk about maybe what these would look like. But before we start to develop these hypotheses, we always begin by asking realist questions. Question 1, what conditions are needed for successful adaptation? Question 2, for whom and under what circumstances is adaptation likely to work? Question 3, how can implementers be supported to adapt program elements without compromising core functions? And finally, through what mechanisms, through what shifts in reasoning will skillful adaptations be made? So let's have a look at each of these questions in turn. What conditions are needed for successful adaptation? Well, we don't really need to go outside of the literature that CIFAR itself has consolidated and synthesized. If we look to this literature, we get some important clues. Adaptation is necessary when local contexts differ significantly from those in which the program was originally developed. And this is because adaptation is theorized as the primary means through which programs are made to fit local systems, local needs, and workflows. If programs aren't designed by local practitioners themselves, then these programs need to be adapted. That's the key point. Question 2, for whom and under what circumstances is adaptation likely to work? Here, the literature is a little more ambiguous, but there are thinkers who believe that adaptation tends to work best for skilled, experienced practitioners who value expert judgment or their own expert judgment and believe adaptation is essential to success. But adaptation also requires certain conditions, and the list here is quite large. I'm just going to name a couple. Innovation should be adaptable. This is straight from CIFAR, straight from the framework. Innovation should be adaptable. They should have modular structures that can be easily customized, swapped, and removed. And leadership needs to support adaptation. They need to create what's known as an authorizing environment, which brings us to the next question. How can implementers be supported to adapt program elements without compromising core functions? And according to the literature, this will almost always involve some kind of training or professional development, perhaps even a community of practice. And the point that gets made here is that adaptation is very difficult. It requires not just technical skills, it requires collective expertise, particular forums where people can come together and they can collectively make sense of things, they can discuss things. And the whole idea is that they need to work towards developing a deep understanding of the program's purpose. So another way that we could describe this, to use some evaluation language, people need to develop a theory of change, and they need to understand that theory of change very well. Finally, through what mechanisms will implementers be enabled to make skillful adaptations? And as we discussed, mechanisms from a realist perspective usually involve changes to people's internal reasoning, to their knowledge, beliefs, motivations, confidence. But at a minimum, implementers should have both clarity and the confidence to know what to add replace, delete, amplify, or tone down when making adaptations. Now, it's important to stress that all of this information is contained, at least partially, within CIFAR or within the broader literature that it draws upon. And as I said, what makes CIFAR so impressive is that it functions as both a synthesis of the literature, but it also beautifully organizes these constructs into these really conceptually clear and sensible domains. The problem is not that this information is missing from the framework or missing from the larger evidence base. It's that these constructs are not causally related. And people like Anton Kisloff refer to frameworks, refer to the constructs as the rudiments of theory. There's more work that still needs to be done to make these constructs causally active. So how might we go about building this program architecture? How might we go about building on CIFAR to create some theories of change that we can actually bring into not only our implementation plans, but also our evaluations of implementation? Well, there are a few options. We can discuss them later, but you could conduct a realist review of the literature to try and identify causal patterns. And you'd want to look at similar classes of interventions that you're working on, or similar processes or strategies of implementation, or perhaps similar contexts. But that's always a good process. It's a very comprehensive process, and it's not it's quite time intensive and resource intensive, but that'll help you get a good sense of the kind of causal patterns that are operative. And you might even be able to start building your hypotheses from a realist review itself. Other things that you could do, you could conduct some theory gleaning interviews with your stakeholders. And realist interviews are very different to other kinds of interviews. Their whole purpose is to really try and present what we as the researchers or evaluators know about the theory that underlies programs, and to get stakeholders to scrutinize that theory, to confirm it, or to modify it, or to challenge it. But the point here is that with realist interviews, the whole idea is that you want to build those interviews around a theory, and you want your stakeholders, who usually are the experts of their programs, to provide expert comment and feedback on your initial theories. You could even facilitate logic modeling workshops, and you would bring all your stakeholders together, and maybe you would introduce a little bit of realist theory, a little bit of realist terminology, and together you would start building out a program architecture about how and why the program works, and maybe drill into specific areas that you think are most causally significant. But the point here is that at some point, you'll need to come up with some hypotheses that map the causal pathways in your program, and then you'll be wanting to test them. So just to give you an example, I've created one that captures the ideas that we've discussed earlier. They're kind of drawn from the CIFAR framework, and it's really just illustrative. So I've named it hypothesis one. When you do realist evaluation, you'll come up with about 30 of these, and it's a constant process of constructing them, refining them, working with your stakeholders, using those hypotheses in your methodology, and it's a constant process of refinement. So this is hypothesis one. It's all about adaptation. And as you can see, it has a particular kind of clause structure. It's known as an if-then proposition. If the active ingredients of programs are well specified, And if proposed modifications to programs are systematically planned, then skillful adaptation is more likely because implementers will have clarity about what to adapt, what to preserve, and why. Now, obviously, this example is just illustrative, but it does highlight why causal reasoning is so important. And so, as a final point, let's return now to our original question. Why do we need fidelity to theory? Well, the reason is as pragmatic as it is epistemological. Whether we prioritize strict adherence or selective adaptation is kind of beside the point. Some programs depend on replication, and this means that the implementation will be tightly controlled. It'll have strong incentive structures. There will be an infrastructure that reinforces standardization. There'll be supervision and other kinds of quality controls. Other programs are so loosely specified that they effectively get reinvented at every site. And so you can think of this whole fidelity fit debate as operating along a continuum from strict adherence or tight controls to adaptations that are doing certain kinds of modifications, replacements, deletions, etc., to try and improve fit. And then at the other end, reinvention, where the program really doesn't resemble the original at all, and it lends itself, but also requires a lot of innovation from your practitioners. The point here is not whether we choose one or the other. I think as evaluators, we should remain fairly agnostic. The point is that we don't approach this problem blindly. And so, as with any set of causal assumptions, implementation, should I just wind it up? Okay, so I think we're recording there. As I was saying, the most important thing is that your program, and you can think of implementation as a program as well, from a realist perspective, it's still a program. The most important thing is that your theory for why it works, your causal assumptions are made explicit, they're clearly articulated, they're built into a program theory, perhaps a theory of change or a really good logic model, and then you go about testing this theory. And testing theory requires us to be faithful to theory. It's fidelity to theory that enables us to build a true understanding of causality. So we can wrap it up there. And I hope you enjoyed it, and over to questions.
Fabulous. Thank you so much, Andrew. That was a really, really interesting journey through the use of realist evaluation in the context of implementation science, and particularly sort of around the consolidative framework for implementation research. Just to say to people, if anybody has any questions, please either pop your hand up, or if there's a silent moment, jump in, or if you want to type your question into the chat, if the conversation is going on, we're happy for your thoughts, your comments and questions. Please fire away while we have Andrew with us. Seamus, I see you've put your hand up, so you can kick us off.
Thanks, Stephanie. Thanks, Andrew, for a very interesting presentation. I'm just thinking, I haven't sort of organised my question too coherently, but I'm aware there are some frameworks that exist around adaptation that specifically prompt us to look at the causal mechanisms, the theory of change that underlie a particular intervention and that contribute to its effectiveness, and that prompt us to distinguish between an intervention's core functions in terms of the kind of core causal mechanisms which contribute to its effectiveness and I guess the evidence base on which it's built, and to distinguish those core functions from forms which they define in terms of a kind of more things that are more peripheral and that aren't necessarily central to that causal pathway to making the intervention work as it's intended. And I can put those in the chat if people are interested. But so I suppose I was interested in your focus on CIFA. Do you, and as I understand it, CIFA kind of functions a bit like a taxonomy, doesn't necessarily aim to unpack or elaborate kind of causal mechanisms the way some theories sort of do. So would you suggest that in terms of trying to, develop make good decisions around adaptation, do you think that every kind of implementation theory or framework like a CIFA has a kind of onus upon it to take account of these kind of causal mechanisms? Or do you think we can pick and choose and be a bit agnostic and turn to some of these other frameworks? Just you might have come across them, but I'm thinking of MADI, so I'm just looking at my screen, the Model for Adaptation, Design and Impact by Kirk et al. And Modify, the Making Optimal Decisions for Intervention Flexibility During Implementation, or Modify, these sorts of frameworks. Yeah, do you think that in your focus on CIFA, do you think that all frameworks should try and do that causal work as well, or can we pick and choose between different frameworks?
Yeah, it's a good question, and it's a fair point too. And I hope that I'm not coming across as critical of CIFA. I really like this framework. I think it's a beautifully organized framework, and it's also serves as a wonderful introduction to implementation science. And it's a point that others have made, other implementation science researchers have made about these determinant frameworks, that where is the causality in these frameworks? They're called determinant frameworks, but how are they actually being causally related to determine these outcomes? I think that I think different frameworks and models can serve different purposes, and I don't think it's fair to expect that all frameworks have to be causal. I'm trying to build an argument in this presentation, and I'm happy for a framework like CIFA to largely just serve as a good taxonomy. As I said, a wonderful introduction to the literature, really good coverage across all of these constructs. And then if you go into the literature, you'll find causality there, but you'll have to do the work. These other frameworks you've mentioned, I'd have to have a look at them, but I'd be very interested to see, are they proposing some actual strategies or conditions or mechanisms for how adaptation can work? And if that's the case, that would be providing a very important function as well. I'm usually a bit doubtful about how well frameworks and models can actually do this work. From my experience, I find the frameworks useful because they provide you with important concepts. They kind of function like sensitizing concepts. They alert you to different things, but you have to do the work to really kind of disaggregate these frameworks, to pull them apart, to go back to the literature, to see how they came up with these constructs, things like, compatibility and the adaptability innovations. Where did they come to these ideas? And then looking, if they're empirical studies, looking at whether these have come from particular contexts. So yeah, so far, I haven't found models and frameworks readily usable in an evaluation of an implementation process. You have to still do a lot of work to build program theories that relate to your program. And to be fair, sometimes I even find, like they call them middle range theories. I find middle range theories, sometimes they have more explanatory value even than the frameworks themselves. And that's an interesting kind of point we can talk about. But yeah, hopefully I've answered your question, and feel free to.
I'll just say one more thing quickly. I know other people get their hands up. I think some of those ones I put in the chat are interesting, and that they do kind of prompt people to develop theories of change. And as you say, it continues to be hard work. They prompt the researcher to do some of those things those strategies you describe, such as conducting interviews with stakeholders and often with the people who developed an intervention to get their kind of qualitative input on what its potential causal mechanisms are and whatnot. So they do list a kind of series of steps which can be quite useful. But one thing that I think is kind of interesting and what potentially is a limitation with some of these frameworks is they're very much prompting you to develop theories of change or causal mechanisms of the intervention and how it results in its effectiveness, but not necessarily to come up with theories of change for how it actually functions in terms of its implementation, which is a different thing. And I guess that's what kind of SEPA does. And so sometimes there can be a potential overlap in that the way something's implemented can contribute to its effectiveness as well. So that's something that these frameworks don't seem to engage in, is the kind of causal mechanisms for the implementation side of things. But anyway, that's enough from me.
No, and
I think really sorry, Andrew, I was just going to jump in and say, I think really there's only so much that we can expect from the various theories, models, and frameworks. There is never going to be one utopian one that's going to include everything that we want to be looking at. So I think it's fine to be critical, Andrew. I think that's part of our role, isn't it? To be kind of saying, well, is there a gap here? Is this something that we need to be thinking about this here? So, sorry, Andrew, did you want to reply to that? Otherwise, I'm going to move on to Lauren.
Not at all. We can move to Laura. I was just looking at the chat, Yvonne made a point, and I couldn't agree more. There's no such thing as a perfect framework. I think they say, no model is true, but all models are potentially useful, or some variation of that phrase.
Yeah.
And they usually provide a kind of guiding framework to start doing some really good work. But at some point, you're going to need a methodology. And we can't confuse frameworks with methodologies. They're very different things, of course. Yeah, please, Lauren.
I think that critical point is knowing where those gaps are so that we can be asking those questions. Yeah, no, I couldn't agree more, Yvonne and Andrew. Lauren, let me come to you because you've been very patiently there with your hand up.
No worries. Thanks, Andrew. I'm going to reach out to you separately. I have actually recently moved from this space of sort of more health implementation to focus exclusively on education, and you have been having a lot of these same thoughts. But one question, and it really does piggyback off the previous question. When you are talking about causal mechanisms, are you talking about the sort of education theory that underlies why a particular program might work, the sort of mechanisms that you might want your practitioners to understand and be able to to work with when they're adapting? Or are you talking about the theory of change of why a particular implementation strategy might work, including adaptation itself? And do you think that when we're doing an implementation activity, say, for example, professional development, that we should be making those sort of behavior change theories explicit to the people that we're teaching? I mean, with education, it's tricky because, when you're educating someone about education, it gets very meta very quickly. But yeah, if you wouldn't mind just sort of clarifying whether you're talking about implementation mechanisms or the mechanisms of the program themselves.
Yeah, thanks for the question. And it helps us build on the first question, actually. It's a really important distinction between, and to be fair, SEPA makes this distinction between the innovation itself and then the things that you're doing with that innovation, including changes to your organizational context to try and embed whatever underlying theory or those active ingredients, try and embed them into your organization. And that's critical. So maybe it's good to use an example. I'm an educational researcher and evaluator. So you might have a program built on explicit teaching. We might call that the innovation. But explicit teaching is, in Pawson's words, it's theory incarnate. So it is a manifestation of particular ideas from the education evidence base about why explicit teaching works. And some of those theories could be like cognitive load theory or schema theory or various other things. But it's an instantiation, a manifestation of that theory. And the two are very different. The innovation is based on a theory. Implementation is also based on a theory. And from a realist perspective, and this is why our logic models do get quite enormous, but from a realist perspective, they are all just part of a system. And you have to make pragmatic decisions about what you're going to focus on. But there is a theory that underpins the innovation, and there is a theory that underpins your implementation strategy. And your implementation strategy might depend on reproduction or replicating things. And so if that's the case, you're going to need things like various standardization measures, quality control, maybe incentives for people, maybe even punishments. I know that's quite a loaded word, but to be fair, Dan Schroeder makes this point precisely. If your theory requires adaptation, it'll be for very different reasons. Maybe the teachers really value their expertise and they don't like departments telling them what to do. They see prescriptiveness as a kind of imposition. It doesn't matter though, because in that logic model that you're creating from a realist perspective, it's going to try and unpack theory all along the implementation chain, including within the intervention itself. It's really important that we separate the two things just conceptually, otherwise it becomes a confused mess. But from a realist perspective, in terms of how we get things working and how we change people's reasoning, it's all going to be based on some kind of theory. Very quick point around behavior change. CIFA again talks about this. They're drawing on, I think it's Mishy's COM-B model. It's a great way to start. There is a problem, and it's a problem not just within implementation science, but also within realist methodology, which is that mechanisms become overly psychologized. They become too much about changing people's thinking and reasoning, and we need to start thinking about where mechanisms can exist elsewhere. Can mechanisms exist within social collectives, social entities, maybe even institutions? Normally, institutional things are seen as like the context, but these are hard questions. But yeah, as a way to start, mechanisms usually involve changes to how people reason, how they feel, their self-efficacy, their motivation. So yeah, thank you for the question. And Stephanie, I'm not sure who's next.
Yes, thank you for that. That was very interesting. Thanks, Lauren. That was a great question. Andrea, you were next. You're very patiently with your hand up.
Thanks, Andrew. That was a great presentation. I just wanted to ask a quite specific question. I really like the realist questions for adaptation. They really resonated with me. I've been working on a project around implementation of advanced and metastatic support groups that are being run by a range of healthcare professionals. So it could be nurses, psychologists, social workers. And we've interviewed them extensively. And the next stage is, I think, been very much highlighted what you've been talking about. We're going to get them together to talk about what we found from our results. And I think what would be really useful would be to, as you described it, facilitate a logic modelling workshop with them to actually understand the program. I think, to seek clarity on the program purpose, but to actually understand the mechanism that is making it work. Because I know there's an awful lot of adaptation in terms of how they actually run the groups at the moment. Are there any good papers that would help me to understand how you do that, a logic modeling workshop, and any examples you can give me?
I'd be happy to, and whatever I find, I'll share with the larger group. I'll get in contact with Shalini or Stephanie. But yeah, more than happy to. It's hard work to do. Like it's definitely a matter of style. People do logic modeling in different ways. There's different technologies you can use. We tend to use an app called Miro. It's an interactive whiteboard, and it's a wonderful thing to use. And yeah, it's a very personal thing, but there would be good guidelines Possibly even videos might be better than actual academic papers. They're more practical. But yeah, I'd be more than happy to help you with that. It's a question I'd like to investigate myself.
Thank you.
Interesting to pull together a whole range of different approaches to it, wouldn't it? Because I'm sure that we won't be alone in thinking about how do we actually do. We talk about this, but actually, how do we actually do it in reality? So, thanks, Andrea. Great question. Yvonne, you've been in the chat and now you've got your hand up. So, over to you.
Thanks, Steph. Thank you, Andrew, for a really great talk. This is just following up on all the discussion that we've just had. You mentioned realist interviews and basing those on theory. And I'm assuming somehow these feed into some kind of co-design process. And I don't mean just co-design of the program, but co-design of the implementation strategies. And there was, I think you mentioned, really basing your realist interviews in theory. And this is a practical question. When you're talking with practitioners, and particularly practitioners who actually do the work on the ground, not necessarily the leaders, as soon as you mention theory, their eyes tend to glaze over. I'm just wondering how you go about presenting that theory without making it sound too theoretical.
Yeah, wonderful. Yeah, so, and again, it's like logic modeling. It's there will be a personal style that you use. So the first thing, realist interviews, they just follow good technique in interviewing. The first thing you want to do is establish that rapport. You want to try and warm people up. You try and perhaps you would start with like some exploratory questions, some easy questions, just to get people's synapses firing, and to kind of alert them to the things that you're interested in. I think it's a great idea to send the research questions ahead of time too, so that you're priming people, because this is not a catch-ya moment. Interviews are just another way to get at theory. So if they've got the time, you can send the interview questions, or maybe even like a short statement about what you're interested in. And then, yeah, that's a fair point. Theory is somewhat stigmatized. So you could use questions that get at theory in a very conversational way. And this is something I learned from Justin Jagosh, who's a big thinker in realist methodology. You might ask a simple question like, what is it about this thing that you think makes the difference? And all you're doing in your questions is you're just trying to embed some causality into the question. And it's a really important point. One thing I'll just say, there seems to be a bit of an emphasis on adaptation these days. And maybe that's come at the cost of adherence, like strict adherence to things. And adherence is not necessarily a bad thing. It always depends on the context. And that's what realists would be wanting to stress. The context matters. So just to give you an example, a fast food franchise would, from a realist perspective, have a program theory. And those fast food franchises would be trying to achieve a certain outcome. Maybe it's consistency of customer experience, or standardization of how food is being made, or whatever it might be. And so you might ask someone a question like, what is it about the training you provide that you think makes a difference? And the difference there would be consistency. So you'd try and just sort of introduce that term. But yeah, to answer your question, you would need to know as much about the program as possible ahead of time, either through research or conversations or whatnot. And you want to come into that interview armed with the theory. Then you want to be take a light touch with how you question the theory. What is it about this that makes the difference? Or why do you think this has this effect? Or what have you noticed when you do these particular things that you've said are really important? What happened? And you're just constantly coming back to causation. I hope that has answered the question, but if you've got a follow-up question, I'm more than happy to answer it.
There's lots to unpack here, Andrew, and I don't think we have time for that. But yeah, I'm not sure that you really touched on the co-design aspect, and a lot of the time
Let me
when
do
you're
that. Yeah.
co-designing, you don't really know what you're getting yourself into, and you don't really understand the context. So it's really important to, maybe not have those preconceived ideas and be open to learn about the context and about the, what the stakeholders actually hold
My apologies. Yeah.
important and true. Yeah.
No, that's right. I did neglect to answer that. I do have some opinions about co-design. They talk about a
Andrew,
teacher
could you have those opinions in 2 minutes?
Yes, I can. Yes. Realist interviews are based on a teacher-learner cycle, and we do come in with presumptions as interviewers. At the beginning of an interview, we're like teachers. We're teaching the interviewee about their theory. We're presenting it. We're guiding them. We're taking a very strong lead. But then halfway through the interview, that role changes and the interviewee becomes the teacher for us. We're learning about the theory. And that would apply to the co-design as well. We're all experts. We would be methodology experts. They would be practitioners and program experts. I'll leave it there.
Thank you, Andrew, and thank you, Yvonne, for that follow-up question. And I think there's obviously a rich vein that we could just be discussing so many different topics. Thank you, Andrew. It's been a very stimulating discussion. There's a few more comments in the chat that you might just want to have a little glance at that we won't necessarily have time to go through today. But obviously, people are very keen on understanding more about this approach, using the approach of realist evaluation. So thank you so much for sharing it and embedding it within implementation science. So that's all we have time for today. Thank you so much, everybody, for joining us today. I'm sure you'll join me, yes, exactly, Karen, in thanking Andrew for a very stimulating talk, and we look forward to seeing you again next month. Toodaloo for now, everybody.
Thank you, everyone.